Hi YouTube, I hope you guys are doing well. I am bringing you another type of video similar to my 9 symptoms of lymphoma that are weird, you might not think is related to cancer, but it could be. That video has reached a lot of people. I'm so happy for that, and a lot of people have messaged me saying that after watching that video they went and got the symptoms checked that they had, and if I can help one person detect cancer or not or whatever early, that's what I'm doing these videos for. So the one that I'm going to bring you today is about leukemia. So I'm going to go over some weird symptoms of leukemia that you might not think is related to cancer, but it could be. So to preface this video, like I did with the first one, because you have these symptoms does not mean you have cancer. Most likely you don't have cancer. This is just to raise awareness that if you are experiencing multiple of these symptoms, then you might want to go ahead and go to the doctor, look into it more. Don't just rely on Google and thinking that this is nothing. But like I said, please also don't freak out because it doesn't mean that you have cancer. So let's get started. So one thing I want to bring to your attention is with leukemia, there is oftentimes no obvious symptoms in the beginning of having leukemia. So if you're experiencing a lot of these different symptoms we're going to talk about, you probably really should go to the doctor now as opposed to waiting, because that means that it's probably progressed. Like with me with lymphoma, I had plenty of different symptoms, but the swollen lymph nodes didn't come until I was already stage 2 cancer. So let's get into the first symptom. So the first weird symptom is bleeding, and the bleeding can come in a lot of different forms, but the most common forms of bleeding that you experience is in the form of, number one, nosebleeds. So if you start having severe, or even just like, they don't have to be severe, but if you start experiencing nosebleeds and you never were a person that got nosebleeds, that can be a symptom of leukemia. And another thing that you might notice is that if you brush your teeth and every single time you brush your teeth you have bleeding gums, then that is another symptom. Another form of bleeding that you can get is you can have bleeding, like heavy bleeding menstrual periods. So if you've never been a person to have that and suddenly you start bleeding out of control during your menstrual periods, that is something that can be attributed to leukemia. In conjunction with the bleeding is if you get a minor cut, like let's say you cut your hand, minor scratch cut, and it is bleeding a lot and it continues to bleed and doesn't just stop bleeding after 20 minutes like your normal cuts, that is another symptom. So you want to pay attention to bleeding if you've had, bleeding gums, nosebleeds, crazy periods, cuts that bleed for longer than they should. That is a very big symptom. Number 2 is easy bruising. So if you are a person that, continually has large bruises all over your body, but you don't remember hitting your leg or stubbing your toe or any of that, but you just have random large bruises out of nowhere on your body, that is a symptom. Then also in conjunction with that, a lot of people notice that there are tiny, like the size of a pinhead, red dots or purple dots that start appearing all over your body. That is another major symptom of leukemia. I can't think of what the name of those dots are, but they are like the size of a pinhead and you start getting them all over your body. Number 3 is when you have leukemia, you have a very high white blood cell count and you start getting, because of that, visual problems. So let's say you have blurry vision or other issues with your vision that you've never had before. Tinnitus, which is ringing in your ears, if you start having ringing in your ears all the time. And then if you have like headaches and mental status changes, so if you've noticed like you're having problems concentrating out of nowhere, you're having vertigo, bad headaches every day, in conjunction with all of this, this can indicate that your white blood cells are extremely elevated, and these are symptoms that are coming along with that. The next one is weight loss, and this is extreme weight loss, not just like 2 pounds, 3 pounds. This is like 20 pounds, 30 pounds, or even 10 pounds if you're not even trying. you'll notice extreme weight loss, and in conjunction with the weight loss, you usually notice that you're not very hungry, or if you eat a very small amount of food, you feel extremely full. And sometimes people experience that their stomach is actually physically swollen. You can kind of feel around that your belly is swollen. And basically, what this is it's a buildup of cells in your liver and spleen, making them larger. And so it kind of makes you more full easily. You have the swelling, and then you might have pain in your side where your spleen is like swollen, and when you go to a doctor they can actually feel that and see if your spleen is swollen. So if you're having that weight loss, that feeling of fullness out of nowhere after eating a small amount, and then if you have a swollen belly, those are symptoms. The next one is bone or joint pain. So the leukemia cells can basically gather around your joints or your bones and cause bone pain. So especially if you're a younger person and you're randomly feeling like, you're in extreme pain in your joints and bones, that's not normal. Obviously, if you're like a weightlifter and your bones hurt or your joints hurt or your muscles hurt after that, that's not what I'm talking about. I'm talking about out of nowhere, you're having bone and joint pain that you've never had before. That can be the leukemia cells accumulating around those joints. So similar to lymphoma, another symptom to watch out for is night sweats. And these aren't just like you get a little sweaty at nighttime. These are extreme. You wake up, you're drenched, your blankets are drenched, your clothing is drenched, you have to change because you sweated so much overnight. Swollen lymph nodes and night sweats are symptoms of both leukemia and lymphoma. So if you're having extreme night sweats and you feel any visible swollen lymph nodes, then that can be a symptom of leukemia as well as lymphoma. If you're watching this, if you have those two things, those are major symptoms. Now, a lot of people ask me about lymph nodes. Do they hurt? Normally, in my experience, cancerous lymph nodes don't really hurt. Your lymph nodes do swell up because of infections. That's what they're supposed to do, but they're not supposed to remain swollen and continue to grow. So if you're having those symptoms, then you definitely need to get checked out. The last one I want to discuss is having consistent and persistent types of infections. So if you constantly have bronchitis, or you constantly feel like you have a sinus infection, or you constantly feel like you have shortness of breath and they're telling you you have, mono every time, persistent and consistent infections and things like that are or can be a symptom of leukemia, that they're hard to get rid of. You consistently have them. Fatigue associated with that. If you have extreme fatigue, just tying your shoes makes you tired. That's not normal. Low-grade fevers all the time, like you're just kind of always sitting at a low-grade fever, that's another symptom. And that obviously you could think, oh, that's just because of my infection, but if you're consistently having these infections, that's not normal. So that completes the weird symptoms of leukemia that you need to be aware of. I hope that this helps someone out there. Definitely feel free to leave a comment, ask questions. I had obviously lymphoma, not leukemia, but I will do my best to, answer any questions. I am not a doctor. Please go to the doctor if you believe that you have these symptoms. I will link below more resources to read about leukemia. If you're thinking that you're experiencing some of these, Leukemia Lymphoma Society is an amazing organization. You can call them, you can talk with them, but the most important thing is you need to advocate for yourself and your health. And if you think something is off, I know it's scary, I know nobody wants to deal with that, but you need to, and you need to be an advocate for yourself. So I hope that helps somebody out there, and I will see you guys in my next video. Bye guys.